Good morning and welcome to the first webinar in the CDSS CalFresh branch's Able-Bodied Adults Without Dependents webinar training series. This webinar series is intended to give county and community partners an initial lay of the land on all things Abawds as we prepare for the return of the Abawd time limit in California on September 1, 2018. My name is Alexis Fernandez and I am the Chief of the CalFresh Policy Section. I'm going to act as MC today and give you all a little introduction. But before we get started, let's go over some logistics. So the webinar is hosted in listen-only mode. There are two ways to listen, via your computer or via phone. The information is on the right-hand panel of your screen. How to ask questions. So we'll be using the question box throughout the webinar presentation. You can type in your question at any time. We do have quite a bit of content today, so we may not have a lot of time at the end of the webinar for Q&A, but we are encouraging people to type in their questions anyway. We'll try to get to as many questions as possible, and we'll be keeping a record of the questions that you provide in order to get back to you offline, as well as to make sure that those questions are answered in future webinars. So please do type in any and all questions through the question box, again, on the right-hand side of your screen in the GoToWebinar panel. And then just as a note, the webinar will be recorded, and we will send folks a copy of the recording and all the presentation materials via email as soon as the webinar is complete. Okay. So the return of the Abawd time limit stands to be one of the most significant policy changes that the CalFresh program has experienced in quite some time. It is a complex rule to implement, both from a client and administrator perspective. Yet it is critically important that California implement effectively, as this could mean the difference between a significant number of Californians losing or maintaining benefits for which they are eligible. With the goals of maximizing benefit access and providing timely and accurate benefits, CDSS has ramped up our pre-implementation efforts. This has included extensive work group meetings, which many of you are involved in. They have focused on developing policy materials and client communications. We'll be spending time working directly with our county partners, and we've launched this webinar series. Each webinar in the 7-part series will cover an Abawd topic in depth and will provide our partners a starting point in developing their own understanding of the Abawd time limit and corresponding rules. The webinar series will also help prepare partners to offer local training and can inform the creation of client and stakeholder materials. We hope these webinars are useful in getting people thinking about the work that they need to do locally in advance of the Abawd time limit implementation. I want to take a minute now to introduce the Abawd team here at CDSS CalFresh. My name again is Alexis Fernandez, and I'm the Chief of the CalFresh Policy Section. And then today you'll hear from two of our Abawd analysts, Amber Bonilla, who is our lead Abawd analyst, and Sydney Schellinger, who recently joined the team as an Abawd analyst as well. We'll be sharing our contact info at the end of the slideshow, and of course you can reach out to us at any time with questions about the Abawd time limit, or if you just want to talk Abawds, we're available. So I'm now going to hand it off to Amber to give us an overview of what we'll be covering today and to get us started. Again, thanks for joining us. We really do appreciate the interest in the topic, and we're excited not to implement the rule, but to see that so many people are planning ahead and looking forward to do this effectively. Amber, take it away.
So good morning, everyone. Again, this is Amber. So just wanted to provide a brief agenda this morning of what we're going to be talking about. So I'm going to start with some background information, and then we'll go into an overview of the general CalFresh work registration requirements and the Abawd time limit, and then we will dive into some key policy topics, which includes identifying Abawds, Abawd exemptions, meeting the work requirement, regaining eligibility, the 15% exemption, and a few others. And then, as Alexis mentioned, we'll end hopefully in time with some Q&A. Okay, so we'll start with some background. The Abawd time limit was introduced as part of the Personal Responsibility and Work Opportunity Reconciliation Act of 1996 under the Clinton administration. And under this act, able-bodied adults without dependents were time limited to 3 months of SNAP benefits in any 36-month period. So states must identify and monitor the 36-month period during which an Abawd individual is subject to the time limit. There are several options states can choose from when deciding on the 36-month period, and California has selected a new option, which is called a fixed statewide clock. Under this option, the same 36-month period is used for all households. So in other words, all Abawds in the state will be on the same timeline regardless of when they apply for benefits or when they become subject to the time limit. The 36-month period continues uninterrupted regardless of whether the individual is meeting the work requirement, exempt, or living in a waived county, etc. And California's 36-month period began this year on January 1st. And starting the clock on January 1st was a deliberate choice to maximize the benefit to the client. When the Abawd waiver expires on September 1 of 2018, Abawds will already be 20 months into their 36-month period. And we've identified that a fixed statewide clock is the best choice for not only CalFresh households, but it's also a wise choice from an implementation perspective. For each month in the 36-month period, the CWD must track an individual Abawad's participation status, and this is tracked using various indicator codes that are input via the SAW system into the Medi-Cal Eligibility Data System, or MEDS. And we'll be covering this topic in much greater detail later on in the series. So participation status tracked must include things like exemption status. Did the individual meet criteria for an exemption in that month? Use of accountable month. An accountable month is any month in which an Abawd receives benefits while not meeting the work requirements. And as a reminder, Abawds are only allowed 3 countable months in the 36-month period. And they must also track things like use of the 3 consecutive months, fulfillment of the work requirement, and if they were assigned a 15% exemption, and all of which we'll go into more detail about. So this brings us to our Abawd population. So we're going to start with our first bucket, which is all CalFresh recipients. All households that receive CalFresh will fall into this bucket. And then narrowing in, we have a subset of CalFresh recipients who are identified as work registrants, and we'll talk more about work registration in just a minute. Even further, we have our Abawd population. So our Abawds are all a subset of our work registration population. And these are folks who are not exempt from CalFresh work registration. And then finally, our last bucket is our Abawds who are actually subject from the time limit, who are not exempt from work registration or from the Abawd provisions. Okay, so I'm going to pass it over to Sydney, who's going to talk a little bit about CalFresh work registration.
All right, good morning, everyone. So we're going to go back to the third circle, basically on the last slide, and discuss work registration information. So all CalFresh recipients are subject to work registration unless exempt. However, for most, they don't realize their work registration just because it's just automatically done via the forms. However, because an exemption for Abawd status is work registration, we wanted to go over what it means to be exempt from work registration, because that is also an exemption for being an Abawd. For many, work registrations will not be asked to perform any of the general requirements, but we wanted to, and also sanctions are applicable, but very, usually don't happen in its very extreme circumstances, so we're not really worried about that. But so, for example, we're just going to go over what it means to be a work registrant for CalFresh. It applies to people who are 16 to 59, working under 30 hours a week,
not complying with the work requirements of another program, not students, and not responsible for a child under the age of 6. And this requires the individual register for work, which is what is done, and then accept suitable employment if offered, and not voluntarily quit or reduce hours from below 30 hours a week. And so now we're going to go over the work registration exemptions, which is if they are under 16 or over 59, they're not a work registrant. If they're attending school or enrolled in an employment and training program at least half-time, physically or mentally unfit for employment, complying with the CalWORKS Welfare to Work requirement, caring for a dependent child under the age of 6, caring for an incapacitated person, or receiving or have applied for unemployment. And so individuals are exempt from work registration, and these are some more examples. Participate in a drug or alcohol treatment program, employed or self-employed for a minimum of 30 hours per week. So as we said before, these exemptions are all an Abawd exemption, because if you're exempt from work registration because of these, you are then exempt from the Abawd status, which means we have fewer people to track in that last category.
Thank you, Cindy. So that brings us to this is Amber again, that brings us to the Abawd time limit. And again, as we mentioned, Abawd eligibility is limited to 3 full months of benefits in a 36-month period while not fulfilling the work requirement or being otherwise exempt. The Abawd time limit differs a bit from work registration in that it applies to individuals that are 18 to 49 that do not have dependents and that are able to work. And again, it requires that Abawds work or participate in a qualifying work activity for at least 20 hours per week or 80 hours per month, averaged monthly. Which brings us to step 1, which is identifying Abawds. So in this step, you want to ask 2 key questions. The first of which being, is this person over 18 or under 49? If the answer is yes, then the next question you will ask is, does the person have any dependents? And if the answer is no, this person is an Abawd and may be subject to the time limit, and you would proceed to step 2. And I'm sorry, Alexa, can you back up one step? I wanted to mention as well that this step is particularly important for our community partners as well, who are working with this population, because this is a key point where you can get people savvy on the time limit, because the Abawd time limit is very complicated and difficult to understand. So being able to intervene with clients at this step and get them to understand the requirement and how they may be exempt is very important. So step 2 is going to be screening for Abawd exemptions. Through discussion with other states and hearing about lessons learned as they've implemented the Abawd time limit, we're pretty confident in saying that this is the most important step, and if there's anything that we can get right, it's going to be screening and making sure that folks who qualify for an exemption are assigned that exemption so they are exempt from the time limit. Other states have found that significant portions, roughly 1/2 to 2/3 of their Abawd population is exempt from the time limit, so proper screening and evaluation is key. Abawds face significant barriers to employment, and there's many reasons that an Abawd may not be able to participate in work, so we'll go over some of the Abawd exemptions now. And I just also wanted to note that our Abawd exemptions are a little more flexible than work registration, so many times if a person is not caught at work registration, they may fall into an Abawd exemption category. So Abawds can be exempt from the time limit if they are responsible for the care of an incapacitated person, and we've clarified that for this exemption in particular, that the incapacitated person does not have to be a part of the CalFresh household. It could be any relative or anyone that's that the Abawd is responsible for caring for. Another exemption is if they reside in a CalFresh household with a member under age 18. This does not have to be the individual's child. It can be the child of another household member, but as long as they are in the same CalFresh household, then the individual could qualify for this exemption. If they're pregnant, any stage of pregnancy, if they are exempt from CalFresh work registration, which Sydney just went over, and if they are physically or mentally unfit to work, and they can be qualified as physically or mentally unfit for any of the following reasons: if they are receiving public or private disability, if the unfitness is obvious, which all of these we will go in depth. Actually, our next webinar is going to be covering Abawd exemptions, so we'll talk in a lot more detail about these. They can also be medically certified as physically or mentally unfit for work if they have a doctor's note or other medical professional. If chronic homelessness falls in this category, struggling with drugs or alcohol, and also escaping domestic violence. Okay, so back to our population buckets. So at this point, we've narrowed in our population and determined that our Abawd client is subject to the time limit. They don't meet criteria for any work registration exemptions or Abawd exemptions, which brings us to step 3 in this process, which is meeting the work requirement, and I will pass back to Sydney to discuss this one.
All right, so as Amber said, we're now on our final group of the population, which is people who have to meet the work requirement. An Abawd subject to the time limit can satisfy this requirement in many different ways, which include paid employment, participating in work activities such as work fair, education and training programs, volunteer and community service, or in-kind work. All must average 20 hours per week or 80 hours a month, but this doesn't have to be exactly 20 hours a week. It has to be 80 hours a month. So if someone, for example, does 15 hours one week and 25 hours the next week, it still averages out to 20 hours per week or 80 hours a month. However, the only exemption to that rule is workfare. Workfare is determined with how much you make, how much you receive. So, for example, California minimum wage, if it was $10 an hour and our average recipient receives $150 a month, they only have to do 15 hours of workfare service a month to receive their CalFresh benefits. And so we'll be going in more detail about that, but that is the basic overview of what workfare is, as well as the different kinds of ways that they can meet the work requirement.
Thank you. This is Amber again. So a note about CalFresh employment and training. Participation in CalFresh ENT does allow Abawds to keep their CalFresh benefits and learn skills to obtain gainful employment. While CalFresh ENT will not solve the challenge of implementing the time limit, having robust skills-based programs can be a good fit for Abawds who are in need of job and career training services. And there is federal funding available. And so if you are interested in ENT or if your county has questions, we can connect you with the right people to get that information. So along with the requirement to report income received over the income reporting threshold, just as all other CalFresh households, Abawds have an additional mid-period reporting requirement to inform the county of a drop in work hours below an average of 20 hours per week or 80 hours per month, with the exception of workfare participation, because that's in-house, so the county will already have access to that information. So if a client is using workfare to meet the Abawd time limit or the Abawd work requirement, they don't need to report mid-period of a drop because it will already be known to the county. And then good cause. So anytime, good cause can be determined anytime a household fails to meet the work requirement for reasons outside of their control. This can include things such as illness, a household emergency, lack of transportation, and as a reminder, CWDs should be assessing for good cause prior to applying a countable month or using a 15% exemption, because it's a good option. It's a good practice to have to assess whether or not a client may have missed meeting the work requirement for reasons they may not have had control of. So 15% exemptions. California receives an allocation of 15% exemptions annually by FNS. This allocation is based on 15% of California's at-risk Abawd population. So 15% of that smallest bucket, 15% of those Abawds who are not exempt from the time limit. One 15% exemption is equal to 1 month of CalFresh benefits for one individual. So California currently has over 800,000 exemptions in the bank. So we use a bank analogy because it works very similar in that any unused exemptions are carried over to the following year. And we've historically underused the 15% exemption, which accounts for the large number that we have banked. So previously, these were distributed to counties based on their NA, CF, or non-assistance caseload size, and current 15% exemption policy and allocation formula, as well as criteria, are still under development. We're not quite sure. We're not quite sure how that's going to be used moving forward, but we want to focus on maximizing utilization so that we make sure that folks get the benefits that we have saved up.
All right, on regaining eligibility. So an Abawd can regain eligibility at any time if they meet the work requirement for 30 consecutive days. This isn't a month, calendar month, but any 30 days. So it could be the 15th to the 15th or anything like that. Also, they can regain eligibility if they now qualify for an exemption, if they move to a waived area, or if they reach the end of the 36-month period, where then they again would just start over with their 3 consecutive months at the beginning of that 36-month period. An Abawd may regain eligibility multiple times during the 36-month period, as long as they meet one of the previous examples used. And so now we have our 3 consecutive months, which is different than the 3 countable months. This is almost just an extra little like fail-safe. So for example, Abawds in certain circumstances can gain 3 additional months of eligibility, which are referred to as 3 consecutive months. These months are consecutive and can only be offered once during a 36-month period. So after they use their 3 countable months and they fall off the program after being part of something to qualify for work, they can receive 3 consecutive months. And these have to be used all at one time, no matter if they become exempt or they receive work in the middle of these 3 months. They have to be in the Abawd clock, one after another.
So just as a point of clarification, this is Alexis. I'll just repeat this one more time because it's a little bit complicated. So once an Abawd is subject to the time limit and is meeting the work requirement, if it so happens that they no longer meet the work requirement, they've used their 3 countable months, and they lose eligibility, they have the opportunity to regain that eligibility by informing the county that they have again worked for 30 days or more, or participated in some qualifying work activity for 30 days or more. Once they've done that, we allow them to regain eligibility, and if they again do not meet the work requirement, we give them 1 additional set of 3 consecutive months at that time. Each Abawd is entitled to this 1 additional set of 3 consecutive months once in any 36-month period. So the order of operations is you're subject to the time limit, you meet the work requirement, for whatever reason you're no longer meeting the work requirement, you've used your 3 countable months, you regain eligibility, again you stop meeting the work requirement, and we offer you 3 more consecutive months after that.
So that brings us to noticing requirements. Per Administrative Notice 1715, state agencies are required to inform Abawd households of the time limit, the work requirement, and exemptions. And we're also required to inform households of the new reporting requirement to inform the CWD of a drop in work hours, as well as provide written notice of adverse action before applying the time limit. So currently, CDSS has, through extensive work group efforts, we've drafted the NOAAs that will be used and informational notice and a few other forms. So we do have an ACL in draft that is out for internal review at this time that will release the 2 NOAAs and the informational notice. So you should be seeing those come through fairly soon once we get the internal review completed. So that brings us to the end of our presentation. At this time, we can open it up for questions. As Alexis mentioned, please submit your questions in the question box, and just keep in mind that we'll be taking a deep dive into many of the topics that we introduced today, so we may hold certain questions until that time, but we'll try to get through as many as we can this morning.
So some questions have already come in. Feel free to continue submitting those. The first question is a point of clarification, and several of them are. So we'll go through these clarifying points for folks. So this first question says that an Abawd has to have a dependent, but I thought that they just had to live in a CalFresh household with a child under 18. So this is a great point of clarification to get us started. So I will go ahead and just jump in here by distinguishing being an Abawd from being an exempt Abawd. So the first thing you need to ask yourself is the person an able-bodied adult without dependents? And the answer to that is going to be yes, no. And then if it's yes, you move on to screening for exemptions. So what we've mixed here is the definition of Abawds, an able-bodied adult without dependents, and those are folks between the ages of 18 and 49, and one of the exemptions, which is if you are an Abawd and you happen to have a child living in your CalFresh home, then you are an Abawd that is exempt from the time limit. And so you do not need to meet the work requirements, but by definition, you still are an Abawd. You're just not subject to the time limit. So I hope that makes sense, and we can go over that again if it would be helpful. Okay, so just give us a minute here to go through some of the other questions. I think there was an error on one of the slides, and we'll clarify here that the age for Abawd is 18 or older and 49 or younger. So you're 18 in a day or 1 day away from being 50.
Mm-hmm.
Okay, so this next question, if the Abawd is employed as an IHSS caregiver, would that count for caring for an incapacitated person? So this is an interesting question that we've not heard before, but my first answer is that if the person is employed as an IHSS caregiver, we'd first want to determine how many hours a week they're working, because they may be meeting the Abawd work requirements regardless of whether they are exempt or not. So that would be question number 1. And then we'll have to do research if there are hours remaining, whether that qualifies you for an exemption.
Mm-hmm.
The regulations don't specify that you are being paid for care of the incapacitated person. So Gabriel, we have your contact information. We'll follow up with you, and then we can address that in a future webinar regarding exemptions and the specifics for each. So we will follow up on that. So Amber, this is a similar question for you. For that exact exemption, responsible for the care of an incapacitated person, does the incapacitated person that the Abawd is caring for have to live in the same address or in the same home?
No, they do not. They can be outside the home, they can be inside. This one is a little bit more loose than the one that you are living with a CalFresh household member under 18. For this one, they do not have to be a part of the CalFresh household or living at the same address.
Okay, so our next question is also about an Abawd exemption, and this is with regards to an Abawd who is disabled, or as the person who asked the question used the term, they have an incapacity. Does that incapacity or disability have to be permanent, or can it be temporary?
It can be, either one will qualify the person for an Abawd exemption. If it's permanent, then I would say this person would not be classified as an Abawd in the first place. If it's temporary, then, and we'll talk more about this during our exemptions webinar, but the length of the exemption will most likely follow through the entire certification period. In certain circumstances, the example we use a lot is if they have like a broken arm or something, and you have evidence that their cast is going to come off in 2 months. At that point, the CWD can assign a temporary exemption that they would need to revisit at the end of that 2-month period.
Great. Okay, I'm going to just scan these questions and see if we have other exemption questions so that we can tackle those first. Regarding the definition for chronic homelessness, I'm not going to put Amber on the spot, but I will let you all know that we will provide that definition on the exemption webinar. We've used the current SNAP definition for chronic homelessness being without a stable residence for more than 90 days as the basis for that definition, and we will go into more detail on an upcoming webinar. But we've definitely, at the work group level, tried to make the definition as user-friendly as possible, and we'll also be using information that's in the case file that the CWD already has about the person. So, for example, if they're receiving the homeless shelter deduction as an indicator to exempt that person. So we will be going into more depth next month, I believe.
Yeah.
Okay, so this is just a quick technical question which we'll answer here. Do people have to register for work if they are not able-bodied? So the work registration process, which stands today in practice, is automated. Basically what happens is each of the consortia runs an evaluation of the information provided through the application process to automatically determine if the person is a work registrant or not. The client doesn't ever really learn about their work registration status. It's not something that we're proactively sharing with the client, since California does not have work requirements related to work registration. So people do not actively, quote unquote, register for work. That's one important piece of information. We do that automatically. And if the person is not able-bodied, so they have some sort of long-term disability, that case information is allowing the person to be exempt from work registration and therefore exempt from the Abawd time limit. So for that individual, those processes would happen automatically. They would not be registered for work, and they would not be included in the Abawd subject to the time limit population. Okay, so this is a good high-level question and worth checking in. So Amber, can you tell us a little bit about whether some counties will continue to receive an Abawd waiver, so that is a waiver from implementing the Abawd time limit once the September 1, 2018 deadline hits? So if you could tell us a little bit about that.
Sure. Yes, definitely not all California counties will come off of the statewide waiver at that time. Unfortunately, we can't inform which counties will not receive the Abawd waiver because you need 24 months worth of data. So we have to wait a little bit before we can fully determine which of those counties will lose their waiver eligibility, but definitely not all of California will come off. And you do not have to apply for a waiver. Those will be given automatically to any county that qualifies for an Abawd waiver. Mm-hmm.
So the waiver eligibility is based on the economy and the unemployment rate in a given state, with California's high unemployment these last few years. We've been under statewide waiver. As the economy improves, certain counties will lose their eligibility for that waiver, and CDSS will apply to maximize waiver coverage so that the least number of people are impacted by the time limit. And as Amber said, we predict, as things stand today, that only a few counties will lose their waiver eligibility. But again, just so we're all clear and not making promises that we can't keep, it's hard to tell at this point since we do have to make those decisions based on unemployment rates over the last 24 months. And as we all know, anything can change. And so at this point, we don't anticipate the whole state losing waiver eligibility, and we'll be informing counties in early 2018, early-ish, April or May of 2018. So that answers one of the questions about when will we know if counties will get a waiver. Okay. And just give us a chance here. We're going through a really long list of questions. Okay. So this is a question about workfare. So if you recall, Sydney talked a little bit about workfare as an option to meet the Abawd work requirements. Workfare is determined, or rather the number of workfare hours you are required to participate in are determined by your benefit allotment divided by the minimum wage. We use the example of a $150 benefit allotment divided by a $10 minimum wage, which would result in a 15-hour workfare requirement. And the question is are workfare hours based on an allotment of 1 or 2? And this is a great question. So the workfare determination is based on the total household CalFresh benefit. So in the example, if the CalFresh benefit were $150 for 2 people who happen to be Abawds, then the workfare requirement is that those 2 Abawds attend workfare for 15 hours. If, in that same example, it's a $150 benefit for an Abawd household of 1, then the workfare requirement is still 15 hours for 1 person instead of 2. So the short answer is you take the benefit amount, you divide it by the minimum wage, and whatever the required hours total, that requirement applies to the Abawds in the household. 1, 2, 3, depending on the size of the household. Now, of course, the larger the household, the more benefits they are likely to receive, and therefore the higher the workfare hours requirement is likely to be.
And just want to clarify that for households of 2 or more, it's 15, in our example, 15 hours total, not per individual. So both individuals can work together to complete the 15 hours. Okay,
here's another question which relates. Can the types of work activities be combined in order to meet the 80 hours averaged monthly or 20 hours per week requirement?
Yes, they can. The only exception to that is for workfare. Workfare is the only work activity that cannot be combined with others because it has its own specific participation requirement.
So you can combine volunteer service, attendance at an employment and training program. You can combine in-kind work with some paid work. Any combination of those qualifying activities can be used to meet the 20-hour per week or 80 hours average monthly requirement.
Yeah.
Okay, just give us a chance here. We're still going through lots of questions, and again, keep submitting them. If we don't get to them on the phone, we will definitely follow up. I'm just going to tackle one technical note. We will be sending out the webinar slides and a recording of the webinar, so that is to come shortly once the recording is available to us. Okay, so here's a question about regaining eligibility. So once you've used your 3 countable months and then are no longer meeting the work requirement, so you've lost eligibility, can you qualify for the additional 3 consecutive months by reporting, or rather, let me reframe this question. How do you qualify for the 3 additional consecutive months after you've been disqualified? Must the Abawd report again that they were employed for 30 days, for the prior 30 days?
Yes, yes.
So let me just rephrase this. The Abawd has to let the county know that they've worked for the last 30 days. There's no way that the county would know that if the Abawd is off the rolls, so they don't have an active case. They're not with the county. The only way that the county would know that they've worked is by letting them know that over the last 30 days, they worked. And so many of our notices, many of the client-facing materials that we're working on in the work group really encourage Abawd to be aware of this. And so that's kind of one of those key messages that our CBOs and county partners can provide to folks. If you start working again, let us know. Let the county know. Give us a call. Better safe than sorry in this case to determine whether you might regain your eligibility and be able to receive benefits once again. Now, important point. Once you've regained eligibility, we're going to be providing you benefits for as long as you continue to meet the work requirements. Only at the time that you again lose your job, maybe you're laid off, will we then provide you the 3 consecutive months. So there's sort of an order of operations here, and really if you're engaged in work, you can continue to receive benefits for quite a while until you once again don't meet that work requirement. Quick question here, will the definition of chronic homelessness be given to us in writing? Yes, it will, and so I'm going to take a minute here to give a plug for the upcoming Abawd Policy Handbook. So our work groups have been hard at work developing pretty extensive written guidance on Abawd policy, including a definition for all the exemptions, details about how you regain eligibility, how you count months, how we're going to track them, and that is slated for release in late September. The work groups, which include counties, community-based stakeholders, advocates, quite a range of people have been really working quite diligently to get that out to folks. So that will be out about a year in advance of the implementation of the time limit, and will also be released with the notices that Amber referenced. And that's version 1.0. We'll definitely be providing additional guidance as needed to our county partners who will be implementing and to our community partners who will be working directly with Abawd. Okay, so Amber, this is a good question about the now second required mid-period report that is specific for Abawd. So when is an Abawd required to report that they've experienced a drop in work hours?
The requirement is the same as IRT, so it's within 10 days that the Abawd is aware that they will not meet the work requirement. So in general, I would probably say it would be within 10 days into the following month, because you never know up until the 30th day, maybe that you are going to be missing out on work hours and that you may be just shy. So again, at that point, it's a good opportunity to assess for a good cause, 15% exemption at that time, but the requirement is the same as the IRTs within 10 days.
So there's just an additional request here for more clarification on workfare, and we will be providing that next month on the exemption webinar. So, I'm sorry, not next month. I'm confusing my schedule. For the webinar to meeting the work requirement, we will be talking about workfare in more detail. So don't worry, that is to come. Okay, I'm just scanning our questions, so bear with me for a minute here. Okay. So we're going to go back to regaining eligibility, and I'm going to do my best now, but I also want to remind folks that this will be covered in its own webinar. But the question here is, we talked about a person being able to regain eligibility multiple times during the 36-month period. But when we discussed consecutive months, we said that they can only receive the consecutive months once in a 36-month period. So this is correct, and I'm going to clarify here. You can, as an Abawd subject to the time limit, you are able to regain eligibility as many times throughout the 36-month period as you possibly could in 36 months. Only the first time that you regain eligibility and stop meeting the work requirement will you be offered 3 consecutive months. After you've received that first set and only set of 3 consecutive months, you can regain again, but you will only receive benefits so long as you meet the work requirement. So if you've regained for the second time, you've already received your 3 consecutive months, you can keep getting benefits while you meet the work requirement, but if by any chance you lose your job or get laid off or stop meeting the work requirement, then that is it. We will discontinue you at that time without providing an additional set of consecutive months. And again, we're going to go into much greater detail on that, but you can regain as many times as feasible during 36-month period. You only receive 1 set of 3 consecutive months. Okay, so here's another logistical question. Are all answers for today's questions, will they be posted or sent to the Abawd work group? Well, they will be recorded. We're going to provide that recording to folks, and we can definitely revisit any of the topics discussed today at the next work group. But you'll have the recording, the webinar slides, and my answers will stand in history. So definitely follow up. We will follow up with that recording. Okay, so are there any plans to link or partner with WIOA workforce programs for the employment and skills training? This is a great question because we made a small plug for employment and training, CalFresh employment and training, but it is important to clarify that if the Abawd who is subject to the time limit is participating in a WIOA workforce training program or some other type of skills-based or workforce training, on-the-job training, all these kind of employment training programs that we have in California, those do qualify. So it does not need to be CalFresh employment and training. It can definitely be a WIOA employment workforce training program. And yes, I think in addition to partnering and promoting CalFresh ENT, we definitely want our counties and community-based stakeholders to connect with their local workforce boards to find out what training is available to an Abawd who is subject to the time limit and wants to meet the work requirement, and hopefully get themselves into employment permanently so that they don't have to deal with this very complicated rule. Okay. So this is a question about the 15% exemption, and we talked a little bit about how those are allocated to the state, and that they're basically each exemption is worth 1 month of benefits for one individual Abawd. And this question is about counties who are still under the waiver this year and may later lose a waiver. And the question is, will there still be 15% exemptions? Yes, there will be. So we definitely have plenty of exemptions going into the first quote-unquote wave of counties who will lose their waiver eligibility, but these exemptions are allocated on an ongoing basis. So in addition to what we have available to us now, we will be allocated 15% exemptions moving forward based on the caseload of Abawds who are subject to the time limit. So yes, there are plenty of those for all counties, and if you are implementing the time limit, you will have access to 15% exemptions for Abawds in your county. Okay, so Amber, this is both a question about the required report and what I'm going to, the overpayments or negative actions. So we'll talk a little bit about what happens when an Abawd does not meet the reporting requirement, their hours drop, more than 10 days pass, and they haven't let a county know. So what are some of the possibilities? And
sure.
there are more than one because it really depends on the individual circumstances, but if you could walk us through.
Sure. Yeah, so as Alexis mentioned, there are a couple of options there. One is you can assess for good cause of whether or not they would have met the work requirement for reasons outside of their control. That is an option. You could apply a 15% exemption in that case to cover the overpayment. You could also establish a claim if you want to. Also wanted to make note that we didn't mention this when we were discussing tracking, but you will have the ability to retroactively apply or change codes within the MEDS calendar. So if it is determined that, say, an Abawd client, in fact, did not meet the work requirement and did not report correctly, you can go back to the MEDS calendar and apply a 15%. You could also check to see if maybe they were exempt. Maybe the person was pregnant and wasn't aware. Maybe they had an illness or whatever the case may be. There's several options that you can walk through before applying an overpayment. So I would say that it's important to follow those steps first before establishing a claim, just for the benefit of the client and the county as well.
So it's definitely an assessment of an individual circumstances. One missed required report does not necessarily result in an overpayment because we have some policy options available to us. But if the client has used their 3 countable months, they do not qualify for good cause, you, for whatever reason, do not have a 15% exemption to provide them, then it is possible that an overpayment would be assessed, just as you would assess an overpayment today if a client missed a required report for income over the IRT. So I think it's important to assess the individual circumstances, maximize these policy options, because we definitely recognize that this population is particularly vulnerable and is just really not going to be able to deal with overpayments. Most of our clients are not, but I just, to put that out there, is to assess for these policy options first and to look at the individual circumstances before establishing an overpayment or overissuance in the case of CalFresh. Excuse me. Okay, so we have a few minutes left here for a couple more questions. Okay, and they're very long, so give me a minute. Okay, so if the household regains eligibility a second time and they don't meet the work requirement, so they worked for 30 consecutive days, we made them eligible once again, but they lose their job, does the household have the choice of receiving the 3 consecutive months, or can they request a discontinuance without receiving the 3 consecutive months and save them for later? So no. From a logistical standpoint, the way that this will work is if you've regained eligibility the first time and you lose your job or you stop meeting the work requirement, we will automatically provide the household 3 consecutive months. One way of thinking of this is similar to transitional CalFresh in that once it's applied, you get the 3 months automatically, and we are not assessing for what happens to you those 3 months. You are given 3 months of CalFresh benefits as a transition, kind of your one extra bonus set of months, if you will. The client won't have a choice. They can't save them for later, and really, we have no guarantee that they will use them later, so we think from a policy perspective, providing those the first time that they regain and then lose their job is the best option. This is a population that struggles to come back to the program, so if they've engaged with you once again and you are able to provide them those 3 months of benefits, then that's what we want to do, instead of running the risk of not providing them benefits to which they're entitled. Okay, and we're going to take just one more question here. Give us a second. This is a good question. So this has to do with the application of minimum wage to the workfare hour requirement and determining how many hours a client would have to participate in workfare to meet the work requirement. So the question is, we have different minimum wages in different cities within our county. Which one do we use to calculate this? So the work group has spent quite a bit of time discussing this. We will use the highest minimum wage where the Abawd resides. So if it is a higher county wage, we use the higher county wage, and in some cases, it's a city wage that might be higher if the Abawd resides in that city, so the address of residence that is on file with the county is in that particular city, then you can use that higher wage. So a good example of a county-wide wage would be the wage in San Francisco, which is higher than the state minimum wage, and you would go ahead and use that county-wide wage. Some counties like Los Angeles County have cities with higher minimum wage, like the city of LA. You can use that higher wage if the Abawd, who is subject to the time limit, resides in that city. And that's all covered in the handbook, and will be discussed more on an upcoming webinar, which is a good transition point to let you all know that we've reached our time. We have lots of questions here that we've received, and we have a record of those questions, so we will review them and either address them in upcoming webinars or reach out to folks directly to provide you the necessary clarification. And then just want to put a plug in for the next webinar. And I'm being told to change the slides. There it is. August 15th from 10 to 11, we'll be taking a deep dive into Abawd exemptions. Registration went out in the same email, so if you haven't registered yet, please do so now. And then as a follow-up to today's webinar, we will be sending all registrants, even if they didn't attend, an email with a link to the webinar recording and the materials. And we've gotten lots of requests to provide materials ahead of time, and we will try to work that in for the August 15th webinar so that you can take notes as we go. All right, well, thanks everyone for participating today. We appreciate the engagement and the questions, and we hope that we'll be able to tackle them either by email or in upcoming webinars.